Hello
Okay.
and welcome to the ASPS International Residence Forum podcast. I'm Dr. Aleksandar plastic surgery resident from Serbia, and on today's episode, we will be talking about surviving plastic surgery training in South America. On today's episode, we are lucky to be joined by Dr. Luis Gerardo Sandoval and to talk about surviving plastic surgery training in South America. It's my pleasure to welcome you.
Thank you, Alexander. I am really glad to be here. Right now, I am here in Peru. It's like I'm in my private practice only. I have like a 10% of my practice in the hospital, in the university hospital. So I am very glad to help all the residents to pursue a career in plastic surgery as myself in South America.
Thank you so much for sharing your experiences with us today. And it's our pleasure and great honor to have you today with us. Can you please tell us something about your background before the plastic surgery residences? How was your childhood? What your what do you have family support in pursuing medicine? And at the end, why do you want? Why did you want to become plastic surgery? What led you to choosing that specialty?
Oh yeah, thank you. First, I wanna thank you all the team of the SPS. Yeah, I want to introduce myself again. My name is Dr. Luis Gerardo Sandoval. So I currently practice my uh, plastic surgery here in Lima, Peru. And my interest in plastic surgery started early in my medical training. What attracted me at the most was a combination of art, anatomy, and precision. Since the beginning, I was really interested in anatomy. So when I was a medical student, always I was in my free time helping in the anatomy lab, in the lab of anatomy in my university. Was in Trujillo, is a city in the north of Peru, and my pre-med university was Universidad Privada de Norreo. So have this training in the early career in anatomy many years uh, has a profound impact in my choosing specialty in the future. Because plastic surgery is based in anatomy, in node anatomy. So I was particularly drawn to plastic surgery because it demands not only technical excellence but also judgment, ethics, and a strong sense of responsibility. So I complete my medical degree in Peru, in UPAO, in Universidad Privada de Norreo. And then I was making my internship. So in Peru, you have 6 years of medical training, and the last year you have your internship. It's like in the last year before you have a degree, you have to stay at least one year in the hospital, and you have four big rotations. One of them is uh, internal medicine, gyn and obstetrics, pediatrics, and surgery. So I have a very, very, very profound situation in surgery because we had in that time, I mean in 2012, one child who has an accident, a gun accident in the abdomen, and in the city where I was doing my internship, we have that child at least 3 months. He had the open wounds. You can see the stomach and the intestines, but we didn't have plastic surgeon there. So the only thing that we did in that time was only cleaning and try to close the wound by its second intention. So I did the doctors who mainly was general surgeons, thoracic surgeons, but they didn't know how to do it. And later on, when we had like a um, consultation, virtual consultation with another surgeon, there was a plastic surgeon in Lima who had a solution. He did a tensor fascial lata flap, and he made another abdominal wall for him. So it was after 6 months in the hospital. So when I finished my internship, uh, I didn't realize that plastic surgery has all of this field, and this has an impact thinking of me, because in Peru there are few plastic surgeons, and and that was the first like the first time that I realized that plastic surgery is for me, because I wanted to help him, and I didn't have the tools in that time. In my hospital, anyone have had the tools in that time. So during my training, I developed a strong foundation in helping these situations, and that was the starting point of everything. Then, well, I did my um, as a medical doctor. Is like a you have to work at least 3 to 4 years in the hospital setting before to apply to our residency.
And what is the process
So
of applying the residency, and like how long does it take, and how it
yeah,
functions
yeah,
in
you in Peru, your residency takes at least 3 to 5 years. It depends if you do first general surgery or if you do in first time plastic surgery. So if you do first general surgery, then to apply, and you have to do 3 years more. And if you apply to plastic surgery, you do 4 to 5 years.
that
Mm.
integrated course on with plastic surgery, does it take only rotations in plastic surgery, or like you also take general surgery, orthopedics, and other fields?
Well, when you are integrated plastic surgery, you do first, in the first year, you do general surgery, orthopedics, and everything. And all the nights, at least you have like a your night shift in plastic surgery. And from the second year to the fourth year, or to the third year, you are only doing plastic surgery. If you do plastic surgery after general surgery, you do 3 years only in plastic surgery.
Mhm, yeah, that's nice. What aspects of plastic surgery training that you mentioned now were uniquely challenging for you, and like, is there any experiences that you would like share with us that shaped your resilience as a surgeon now?
Well, in Peru, we have like I want to begin because I want to begin with the spots. In Peru, we have like at least 3 to 5 spots in all the country. So you are only in a hospital. It is one resident per year.
Oh yeah.
So it's when you enter, you have a lot to do.
Hmm.
And in the first year is everything new to you, even if you have surgery training, because plastic surgery is totally different than general surgery. It's new concepts, and you have to study a lot, but you have to see a lot. So every day we have like a cases from everything, from cleft and lip to do facial flaps, pedicle flaps. We work in the hospital uh, with orthopedics, so we did a lot of limb flaps. So when you in my country, my university, when you enter to the program, it's a lot. So that's the reason why when I entered, my mentor, Ricardo Gomez, encouraged me to enter to the SPS and other societies, and that was how I knew about ASPS. So they have a platform called REC, resident education center where they have all the basics of every field of plastic surgery. You have modules from cleft lip, breast reconstruction, limb reconstruction. So in the hospital, we did the our master classes every day in the night and in the morning at 6 or 7 a.m. We have like a discussing the cases that we are going to operate, because we see everything every day. Always the first year is the more challenging because you have to you have to study, you have to stay all the day in the hospital because you are only one resident. So if when you are alone with all the resident in the first year or in the last year, you divide the work because always the resident of the fifth years started to do burns, local flaps, and then you are making more complexity flaps. But here, because we are a few residents, you start to do since the beginning operations with your mentors. So it's have advantages and disadvantages. The
What do you
advantages
think?
is that you have training in general surgery, you can adapt very quickly. But the disadvantage is that you have to um, you have to study a lot because many surgeries you are doing in your first time and your mentor also is with you, but because we have a very long list of surgeries, you have to you have to put your best. It's not currently in the hospital. The waiting list Italy is about 8 to 1 year to get a surgery because the demanding is too high. But we are only one plastic surgeon per year in the hospital in the program. So we have like a is very challenging for everyone because the spots are put by the government, the university, because they are all paid to the resident. So it's like a very challenging to get all the surgeons that we want because we operate every day, but we have more people that want plastic surgery, and mainly the plastic surgeons are formed in Lima, in the capital, and we have other cities that they don't have resident in plastic surgery. And if, like me, when I was in my internship, when I have that case of the child, if you want to get a treatment for plastic surgery, they have to send the patient to the capital, but it's like a long wait list. That's the main problem in the country, that we need more, but the government is who makes spots.
But as a plastic surgery as a residency, there is it like high demanded from medical doctors
Hello.
that like applying for residency, or
Okay.
what is the situation on it?
Hello. I didn't hear you. Can you hear me?
Yes, I'm gonna repeat. So I was asking about the interest of plastic surgery as a residency between medical doctors that just had graduated from medical schools. Are they willing to do plastic surgery residency, or is it like only up to the country development of the health system?
In Peru, to get plastic surgery is you have to take the medical residency exam. So it is the same exam for everyone, and you only choose in a strict order of merit. So, for example, one per year is the exam in July or June, and all the medical applicants takes the same exam at the same time in different universities. And in the night they put all the lists, and you choose your specialty in a strict order of merit. And every year, all the first places of more than 5,000 medical doctors chooses plastic surgery. At least in Peru, plastic surgery is the most demanded specialty and the most difficult to enter. For example, in my I applied to plastic surgery 3 times. There was in my last year there was only 2 vacants, so in my year I had the first place of all the medical doctors in my country. So it's like a there are a few spots, but it's very difficult to enter. But we need more. That's the problem.
Okay. Today's topic, our topic is thriving plastic surgery training in Latin America and South America. So my question would be, how has your cultural background and national identity influenced the way you navigate the program and during the training? Is there anything special that you would mention?
Well, in I have in South America, um, there is different. The training is different in the country. For example, in Brazil, um, you have more than 20 school of plastic surgery. So they chose locals and internationals. So you can apply if you want to Brazil, but the problem for international is that they don't pay you. If you want to do plastic surgery in Brazil, uh, at least in 90% of the cases, you don't receive any payment. In Argentina, is different. They pay you, so you have to first do general surgery in all cases, and then you apply to plastic surgery as a subspecialty. In Ecuador, Colombia, is the same as Peru. You have to do first general surgery, or you have an integrated program at least 4 to 5 years. But in the subspecialty or fellowship is different. When you finish your training, you can apply to a fellowship in at least all the countries in South America. For example, if you want in Argentina, is very well known to do breast surgery. So there is a hospital called Hospital Italiano of Buenos Aires. So they have spots for international uh, plastic surgeons. So you have to first apply and then convalidate your degree, and you have 1 year of fellowship. In Brazil, it's the same. If you want to apply to fellowship, you have to first convalidate your degree, and then you can apply at least 1 to 2 years of fellowship. In Peru, we don't have like a fellowship uh, by university. We have like a fellowship in the hospital. So if you want to apply a breast reconstruction program, you can apply here in Peru, and it's allowed to all international plastic surgeons also. In Colombia, they have a fellowship, but more focused in aesthetics. We have like a organization like SAPS, South American Plastic Surgery. They have fellowship in aesthetics mainly. So many plastic surgeons from all Latin America applies to SAPS, and um, have they have like a rotations internationally. For example, you apply to Colombia, but you can make rotations in Brazil, in Ecuador, mainly focusing aesthetics. So that's the way you can pursue a career in South America. Many plastic surgeons from around the world uh, visit South America right now for mainly aesthetics. Honestly, I've seen international fellows, but only in aesthetics in Peru and in South America, except in Argentina, that they focus on breast reconstruction. So they have many fellows, many international fellows in breast reconstruction. But in South America, at least 80% of the plastic surgeons do a 50-50 in aesthetics. In the hospital, the payment is very low. So that's the reason why most of plastic surgeons are doing at least 50% to 80% aesthetics.
And one question about like the situation in Peru, like in ratio of private and public, like university hospitals, is plastic surgery done more in private or like public ones?
Well, in Peru, for example, in the hospital, you are only allowed to do reconstruction. You don't have training in aesthetics in the public hospitals. So you only do reconstruction. Uh, Mainly the university hospitals like Universidad Peruana Cayetano Heredia, where I was trained in plastic surgery, they have programs to help children with cleft lip or breast reconstruction. If you want to do aesthetics, you only do in private clinics.
My next question would be what support did you help the most during the residency program? Were there your mentors, peers, family, or maybe some resident colleagues, or some institutional resources? What were the most essential for your success during the residence training?
Well, um, when I was starting my residency, I think that I was very lucky to enter mentorship. You know, I had the Propel mentorship. It helped me a lot because when you enter to a new program and when you are alone and when you have only your mentors, but you only see uh, what is locally, But when you have mentors that are around the world, you see a more broad spectrum of of trainings, different focuses on everything. So this mentorship helped me a lot because I started to do research. I had how to how to do best of my skills. I have very glad. I am very glad because all the mentors that I had, they always told me, Gerardo, always Gerardo, um, please, you have to do this. If you want to, for example, if you want to to do better breast reconstruction, you have to make this, for example, this kind of notes, this kind of planification. So mentorship is crucial. Then you have resources. Right now, I think that we have resources from the ASPS, from another institutions like ISAPS, or from Aesthetic Society that currently they have virtual platforms that help a lot. And in your residency training, you can get the most of the experts, and all is in the platform. So I think that as a resident right now, we have a lot of resources to help to be the best of ourselves. I think that in parallel with the clinical work, it may involve in academic in research activities is like a it must be a priority because when you are doing that, you are making more effort to do the best, using the best protocols, using evidence based medicine, and you can see your results in time. For example, every day when we have like a local flap, propeller flap, in our training, we have to take a lot of pictures. We have to make the follow up. If we have maybe partial necrosis, always we have to make round tables to get solutions to that. So that's the way that mentorship works. Because if you make always the same and you don't improve yourself without your mentors, the path will be more difficult. So I think that mentorship is crucial. Then I think that virtual platforms are very helpful to understand because every plastic surgeon doesn't look doesn't operate the same. You have to learn from the experts. You have video resources. You have live surgeries. So you have to take advantage of all of that if you want to improve yourself. And then you can to apply to a fellowship. I applied a fellowship. I was in Rotterdam at the end of my training. I did a fellowship of facial and breast aesthetic and reconstruction. So I had the opportunity to be with Dr. Jorun Stevens, Dr. Jacques van der Meulen, uh, and they were my mentors there as others mentors in Rotterdam. So I learned a lot because it's different how to manage your patient in each country. And if you want to be the best, you have to visit the best. That's the way I see it. And all the mentors always tell if you want to improve yourself, you have to visit, you have to always keep learning, you have to be humble, you have to learn from your mistakes. Every day is a learning. So the best advice that I give to every resident that is hearing this podcast is that always stay humble, always stay um, allowed to learn, and always uh, try to study every day, planning your cases. If you have paramedian for half lab to make a reconstruction, always at least 2 or 3 nights before planning your surgery. Take pictures, make schedules, make drawings, and after the surgery, learn from your mistakes. What did you do well? What did you do wrong? That's the way I try to make my residency. That's the way it helped me a lot.
What do you think about the support of family? Is it important? Can it be also um,
I think
drive?
that no, I think that your family is key. My wife is also a doctor. She's currently doing her residency in dermatology. And when I started my residency, my kids, I have 2 kids, two beautiful kids, were the oldest was 3 years and the youngest was 1.5 year. So we live in the north of Peru in the first time in my first year. When I traveled to Lima to make the plastic surgery residency, I have to separate with them because I have to rent an apartment, and then in the second year they moved to Lima. So it's very important the support of your family because it's not easy, when you are pursuing your career and you have to travel. It's not easy to travel with all of them. So in my first year, I have to be alone here until they can move here. So the support of your family is key, and that's the reason I think that every doctor who has a family, I think that the first place has to be them. You are here to make everything right, but without the support of your family, I think that not will be the same. I think that I have the lucky to to have a wife that support me, my parents support me, and I think that stay with your family is the key of success.
I really agree with that, and like all the support of family that we all have, it's really nothing matters that much. Can you share with us some other, if you had some other hard moments during your training, and what helped you to overcome them?
Well, I remember I had one patient. I was in my last month, I think last 2 3 months of training, and I was in my home with my wife we were like seeing a movie at midnight, and I received a call, and they told me, we had an accident. You have time to get to the hospital. I went to the hospital. The I see the patient. The patient got the eyeball, out, at least at the half out of the orbit. He have a car accident, multiple fractures. So I entered with the team, and we made the reconstruction. At least was 10 hours, I think. Um, Honestly, we thought that the patient will die, but he was very resilient, and everything was well, at least in the first month. And then in the second month, he had a, I think that the most uh, worst degree of ectropion. The scarring was very bad because he had multiple fractures. We have to do a lot of flaps. So he was right. He was mentally well because he had multiple trauma. But he started the second part of this path with this guy. At least I operate him 6 times. The last operation with him was 2 months ago. And when people see the before and after, he doesn't believe me that he had 6 surgeries because he wanted to be as much normal than before. So we promised him that we are going to pray him until he is very happy. And the last surgery was to correct only the we put fat grafting to improve the contours, and right now he's looking, I think, 95% as before. And that's the reason when and that's was amazing because in the beginning we were thinking, oh my god, this is a young guy, he has an accident and he will be never the same because the scarring was so bad, and we have to do a lot of to do ourselves, and he was very resilient. And right now he's one of the faces of our program because when people see his case, they trust in the team because it's a teamwork. When you have a surgery, you put everything to restore the people lives, but sometimes the scarring doesn't go well, and when the patient trusts you and you correct that, maybe you improve the technique, or maybe you stay always with your patient, the results in the long way are the better. So I think that he, after 6 surgeries, is the I think the most happy patient that I ever have in my life, and was 6 surgeries, at least 4 years, I think, 4 to 5 years.
So as I can like imagine this, that particular patient with some current cases, like when you have them and when you accomplish their loc or like a successful surgeries in parts of reconstructive surgery, all of that shows that like all the struggle during the residency and during studying pays off. Do you agree with that?
Yeah, when in my hospital we have a lot of breast reconstruction. I think that breast reconstruction is one of the surgeries that change a lot the mental health of women. Uh, but if you compare, uh, I know, breast reconstruction with facial reconstruction, both have very hard challenges. but it's very difficult because it's very different, because when you do the face, the patient had depression many all the way, all the time that he's he's in the program to make reconstruction. They have to be with psychologists, with with psychiatrists, and the woman who had breast reconstruction also have this depression. But when you finish, when you make the breast again, when you make the face reconstruction, the happiness of your patient is so big that that's the best price that you have as a surgeon. I think that plastic surgery has many privilege to all the doctors, because we can restore people. We can restore the lives of the people. So it's very a hard work, is a lifetime work, and we have the opportunity to restore life. That's the best of plastic surgery.
It's really nice to hear that, and I completely agree with you. What would be the key advice that you would give to future plastic surgery residents across South America who may will be struggling with the same problems that you had? Not that like that there are many problems, but some of them as centralized system and something as you mentioned. What advice would you give them uh, in order to pursue the career?
Well, I think that the best advice is to have resilience. If you want to do plastic surgery in South America, uh, you have it's very difficult to enter to a program. It's not easy. So you have to have resilience to pursue a career in plastics. If you apply and you don't enter, it doesn't matter. You can apply next time. I applied 3 times to pursue my dreams. So when you enter to a program, I think that you are making your dreams. Always stay humble. Always keep up to learn. Always hear your mentors. Your mentors are your second fathers. Sometimes they can be very hard with you. Sometimes they can be they can have very happy moments. But always hear the experience, listen the experience of your mentors. I think that's key. When you travel to a congress or to a meeting to expose your work, always keep learning. Always ask. Don't hesitate to ask. All the people are very glad when you ask him, even if you have 30 years of experience or you have 5 years of experience. I think that every plastic surgeon has made a similar path. When you are young, when you are starting, you can be afraid to asking. No, don't be afraid to ask. I think that asking is is the best way that you can learn. Don't be afraid to ask anything. I think sometimes the things that you are thinking that are, I think that questions that are very basic. No, even the basic questions can give you the best advices. Always with your friends, stay as your team. You always are learning, constantly learning for your friends. Even if you are last year resident or first year resident, I think that in plastic surgery, the best way to keep learning is to work in a team. So you have to teach your residents. If you are the last year residency, be a good mentor. Don't try to think that you know everything. I think that when you start to think that you know everything, you are making the worst mistake, because plastic surgery is so high, is so big that even if you study all your life, you can be an expert in everything. So my big advice to all the future residents is to have resilience, stay humble always, asking always, learn from your mistakes always stay with your patient, giving support, call them, make notes, take pictures, always follow them up because you can follow how you are making your notes, you can follow how is the mental health for your patient. Even a call, even a text is important. Stay always, take care always of your peers. If your colleague has a mistake, support him, support her. I think that plastic surgery is all about collaboration. It's all about support, and it's all about taking care of people.
You say it really right, and it's really nice to hear that point of the end of this session of the podcast. I would like to thank you for coming on today's show to talk us about cesarean plastic surgery training in South America. And thank you for being with us and sharing all these stories that will help all residents around the world and also particularly residents in South America.
No, thank you, Alexander, Edward, and all the team of AFPNs. I think that making this podcast is a huge deal for all residents and even attendings. Thank you so much to having me here.
We hope you enjoyed this episode of the Enhance Your Practice podcast series brought to you by ASPS University. You can listen to our other episodes on any of the podcast platforms where they are currently available, or you can download recordings directly from ASPS EdNet. New seasons and episodes coming soon on practice management. Please contact ASPS Education with your feedback and suggestions for future podcast topics. Thank you for tuning in.